Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, the highlights. Governor of Edo State stresses need for regular manpower training in the healthcare sector as key to COVID-19 response. Vice Chancellor of Federal University Ekiti State says institution heads must take the lead in getting vaccinated. And Director General of the World Health Organization visits various vaccine-related sites around Cape Town and other facilities playing critical roles in the COVID-19 pandemic. Thank you for joining us. The National Primary Healthcare Development Agency is meeting with 36 state commissioners of health. According to the agency, the key objectives of the meeting is to sensitize commissioners of health on public healthcare performance monitoring and the funding of COVID-19 preparedness and response project. Meanwhile, the global COVID death toll has passed 5.7 million. According to researchers at Johns Hopkins University, infections have raced past 400 million to a worldwide figure of 405,994,662. Nigeria's daily COVID cases continued on a low count last night, with 48 infections recorded. The Nigeria Center for Disease Control, NCDC, said the infections were logged in 9 states. Here's more on the pandemic update.
48 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT. That's an increase from figures reported earlier. Lagos accounted for the highest number of cases with 15 infections. Cross River had 12, FCT 8, Plateau 7, Ogun 2, while Abia, Delta and Oyo and Rivers logged 1 case each. The total confirmed cases in Nigeria now stands at 253,923. The report also includes 0 cases from Bauchi, Ekiti, Gombe, Nasarawa, Osun, Ondo and Sokoto states. 72 patients have been discharged in the last 24 hours, increasing the total number of recoveries to over 230,000. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,139. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by Ondo and Benue State. Over 16.1 million eligible Nigerians targeted for COVID-19 vaccinations have received their first dose, while more than 6.6 million of the population have been fully vaccinated. In Africa, over 10.9 million persons have tested positive, while over 243,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 406 million, while deaths are now beyond 5.7 million.
The Governor of Edo State, Mr. Godwin Obaseki, has stressed the need for regular manpower training in the healthcare sector. According to him, infrastructure and equipment will not suffice in providing quality healthcare services to the people. Godwin Obaseki admitted that the impact of the coronavirus could have been a lot worse in Edo State if the present administration had not embarked on training its healthcare workers before the pandemic struck. He was speaking at a workshop for stakeholders in the health sector in Benin City, the state capital, where he also warned against unauthorized private practices among the state government's healthcare personnel.
Healthcare is about people. It's about manpower. It's not about hospitals, not about buildings. It's about the people who are supposed to deliver care to the citizens. And when we were doing this, we had no idea that we will have a global pandemic. We just knew that the right thing to do was to transform and improve your healthcare system. And therefore, when the pandemic hit in 2019, 2020, we were almost caught napping. And because we knew that this was going to be a life-changing phenomenon, we tried to put together a team of experts from across the healthcare system in Edo State, and we started to work. And I met with them at 9 a.m. every morning, and that gave me an insight into the situation of our healthcare system in Edo. And this whole idea of double dipping, it can't work again. If you want to work as an operator in my own healthcare system, then you cannot be working your own at the same time and double dipping. If that is going to happen, we must have an agreement where there's transparency. You're not referring patients that have come to for my care to your and moving drugs and services equipment that I have provided for your own private use. It's not fair, it's not right, it's not ethical.
Elsewhere, the Vice-Chancellor of the Federal University, Oye, in Ekiti State, says it is important for institutional heads to lead by example by getting vaccinated for COVID-19 publicly. He also encourages staff and students of the institution to get vaccinated, as important travels will be hindered without vaccination, in addition to the danger posed to public health.
This program, which commenced agriculture. Thank you very much. We have vision of Professor Abayomi's Sunday.
And Africa is on track to end the disruption caused by the COVID-19 pandemic in 2022, almost 2 years after the continent identified its first case. This is according to the World Health Organization Regional Director for Africa, Dr. Matshidiso Moeti. According to WHO data, the African continent has witnessed 4 waves of COVID-19 infections over the past 2 years, each with higher peaks or more total new cases than the previous one. With African countries' epidemic prevention and control measures becoming more effective, each wave became shorter, while the death rate has dropped from 2.5% to 0.8%.
The pandemic has taken a brutal toll, with tens of thousands of lives lost and incalculable damage wrought to African economies and communities. The World Bank estimates that the pandemic has pushed up to 40 million people in Africa into poverty. Controlling this pandemic must be a priority if we are also to end the disruption and destruction and begin regaining control over our lives.
Staying with the World Health Organization, the Director General, Dr. Tedros Ghebreyesus, and the Belgian Minister of Development Cooperation, Ms. Myriame Ketir, are on a 2-day visit to various vaccine-related sites around Cape Town. The delegation is hosted by the Department of Science and Innovation, the Department of Health, and other partners. The visit is focused on the mRNA vaccine technology transfer hub and ongoing vaccination initiatives, including the mRNA hub at Afrigen Genomic Sequencing at the Biomedical Research Institute and the fill and finish facility at BioVac. Dr. Tedros paid a visit to President Ramaphosa at the president's official residence to engage with the president in his capacity as the African Union COVID-19 champion. Dr. Ghebreyesus commended South Africa's capability in this regard.
That vaccines have saved countless lives, are helping to turn the tide on the pandemic. That's why we're meeting in person after a long jail, and are now giving many countries the confidence to relax restrictions. But as you know, this scientific triumph has been marred by vast inequities in access. more than half of the world's population is now fully vaccinated. And yet, 84% of the population of Africa is yet to receive a single dose. Much of this inequity has been driven by the fact that globally vaccine production is concentrated in a few, mostly high-income countries. One of the most obvious lessons of the pandemic, therefore, is the urgent need to increase local production of vaccines, especially in low and middle-income countries. That's why, in April last year, WHO issued a call for expression of interests for establishing a technology transfer hub for mRNA vaccines. The turnout of applications was high, but South Africa was chosen as a hub for the mRNA because of several reasons. And the hub was established here in South Africa as a partnership between WHO, Afrigen Biologics, the Biologicals and Vaccines Institute of Southern Africa, or BioVac, the Southern African Medical Research Council, the Africa Centers for Disease Control and Prevention, and the Medicines Patent Pool. We very much appreciate the strong support for the hub from Belgium, Canada, the European Union, France, Germany, and Norway. And it's already producing results, with Afrigen's announcement last week that it has produced its own mRNA vaccine based on publicly available information about the composition of an existing vaccine.
In the meantime, the World Health Organization's chief scientist, Sumaya Swaminathan, says the world is not yet at the end of the COVID-19 pandemic, as there would be more coronavirus variants. She made this known in South Africa, where she was visiting vaccine manufacturing facilities alongside the WHO Director General.
We have seen the virus evolve, mutate, and in fact, the Omicron variant was detected here in South Africa. The whole world came to know about it because of the scientists here. So we know that there will be more variants of concern, and so we're not at the end of the pandemic.
Well, pharmacists play a critical role in implementing and promoting public health policies, particularly during pandemics. A study aimed to increase the rollout of COVID-19 vaccines in a coordinated manner in Taiwan found that community pharmacies can potentially enhance the efficiency and equitable distribution of health supplies and resources. But what happens when the administrators are hesitant themselves? Dr. Obaseki, a public health physician and pharmacist, joins us on the program via telephone. Thanks for joining us. First, I'd like to get your assessment of the fourth wave and the state's vaccination campaigns so far.
Okay, thank you for having me. Right now, I can say categorically that Nigeria is experiencing the fourth wave of the COVID-19 pandemic, which is orchestrated largely by the proliferation of the Omicron variant of the COVID-19 virus. And so far, what we are observing from the field is that the spread of the Omicron variant is much higher than the previous variants, but also we are noticing that the mortality is far less than what we had or what we recorded with the Delta variant. And we are also observing, too, that with the expansion in terms of coverage of the COVID-19 vaccine, we are seeing even much lesser cases because among healthcare professionals, healthcare workers in Nigeria, we are seeing that even though many of them are still coming down with the virus, but the the manifestation of symptoms is quite low, and we are seeing very, 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 very low cases of complications arising from infection. So we can say categorically that the vaccine has come in handy and has really helped to reduce, the severity and, of course, even the transmission from person to person compared to...
Hold on a moment. Dr. Ekadem, sorry to interrupt, but we're going on a break now. But think about this question, and this is the low cases we're experiencing. Do you think that we actually have more cases, and so this is Omicron that has spread, and perhaps a lot of people are carriers and don't know they have it, and because it's Omicron, you can transmit it faster, but then a lot of people are asymptomatic. What do you think is responsible for our case numbers right now? So something to think about when we return. We still have our public health physician on this issue. Please stay with us. Welcome back. We've been talking to a public health physician and pharmacist, Dr. Obaseki Akanem. Thanks for your patience. So about that question, do you think that our numbers, in terms of infection numbers, are clearly what it is, the truth of Omicron, COVID-19 in the country?
Yes. So the thing is, to be really frank about the current situation, the numbers are reflective of this true situation because we've seen a number of cases of COVID-19, the Omicron variant, wherein they are not reported. For example, we see a lot of cases in the clinics of people who come down with symptoms that are similar to that of COVID-19, but in many cases, they actually do not even go for testing. So it's highly possible that even the numbers that we're seeing is even far below what we expect. The doubling time of Omicron is far higher than any other variant we've seen since the beginning of this pandemic. But because the symptoms are quite milder, in fact, a number of persons experience the symptoms without even suspecting that it could be COVID-19. So that's why the numbers doesn't seem to be so high compared to the doubling time and other attributes of the Omicron variant. I think one way we can actually have a better picture is if we can increase testing at all the points of healthcare delivery, whether it is in the community or in healthcare institutions. We need to increase testing. That way we can actually see more cases of this Omicron variant.
All right. Now, we know that vaccinations are ongoing, and to improve the access, many countries, including Nigeria, expanded the role of pharmacists, community pharmacists, to include vaccine administration. Do you think that this is good, and will we be able to meet our targets for herd immunity?
Yes, thank you very much. Let me speak as the Secretary of the Vaccine Administration and Monitoring and Evaluation Committee that is in charge of the rollout of the vaccine in community pharmacy. Okay, so this is a very good development, and I can tell you that so far, especially in Abuja, where the project has already started, we are seeing lots of people come to pharmacy. Now, one of the reasons why they appreciate going to pharmacy is because pharmacy are more ubiquitous. I mean, you have pharmacies dotted almost everywhere in major cities and metropolitan area. Secondly, most pharmacies have a long working hour. So from 8 a.m. in the morning, even up to 10 p.m., people who are interested in taking the vaccine can go to the pharmacy and take the vaccine without having to have any prior appointment. So pharmacy increases access to the vaccine, to the services, so people can have more access to the vaccine. Because I know that when there is more access and when there is more advocacy, then we'll have more people taking the vaccine, and that way we will go faster towards achieving herd immunity for COVID-19.
But Dr. Ekanem, that becomes a problem when the pharmacists themselves are hesitant.
Yes, Yeah, so I think what we need to do is at this time, and which is one of the things that the VAME committee, which I'm the secretary of, is doing, is to make sure that we sensitize even the healthcare workers, in this case the pharmacists. Because I'm telling you from a personal experience that I've seen a pharmacist who said that she cannot take the vaccine and that she would tell, she would discourage anybody that she says from taking the vaccine. So I think we need to do more work by speaking and, raising the awareness, or rather improving the knowledge and attitude of pharmacists, towards this vaccine, because at this time, since they are the service providers, they have a very significant role to play to ensure that they don't only provide this service, but encourage people to take this vaccine. So I think it is the work that we need to do. So I think maybe the Association of Community Pharmacy of Nigeria and the National Primary Healthcare Development Agency need to work out a strategy to make sure that all pharmacists in Nigeria, particularly the community pharmacists, are well informed about the vaccine so that they will provide the service without reluctance and also encourage the teeming Nigerians that come to access their services to take the vaccine.
We appreciate your time. Thank you. Dr. Obaseki Ekanem is a public health physician, also a pharmacist. Thanks for joining us this evening.
Thank you for having me.
And Germany has recorded around 120,000 deaths from COVID-19. That's according to the latest figures from the country's Public Health Institute. It has reported nearly 12 million infections during the course of the pandemic. Novavax says its COVID vaccine has proved safe and effective in a study of 12 to 17-year-olds. Armed with the new data, Novavax plans to soon seek expanded use of its shots down to age 12 later this year. It also plans to begin testing in younger children. Deutsche Welle correspondent Chiponda Chimbelu joins us from Berlin. Hi, Chiponda. Can you give us an update of how Germany is coping with the pandemic?
Well, in terms of where Germany is, the health minister, Karl Lauterbach, has said that we haven't seen the highest number of new COVID infections yet. He has said that he's expecting around 400,000 by mid-February, which is around next week. Right now, we've been hovering around 240,000 to 250,000 in the last week or so. So we could see more new COVID infections reported on a daily basis. In terms of hospitalizations, we've also seen a higher number of hospitalizations compared to last week. Some estimations put that at around 25%, and around 10% of the intensive care units are occupied by COVID patients. So that's why the health minister is warning that things are not as bad as they could get. So it's sort of the worst of this wave so far, but it's of course not the worst we've seen in the country in terms of hospitalizations, for instance. So it's better because, of course, of the level of vaccinations we have so far.
But how do you compare it, Germany, to other European countries?
Well, in terms of new COVID infections, Germany is quite similar to countries like Denmark or the UK, for instance. But in terms of vaccination, so full vaccination, Germany is sort of between 70-75% full vaccination. So that's 2 doses of a COVID vaccine, and that's sort of what the issue is. So a lot of the other countries like Denmark, England, they've been reopening and loosening restrictions. You know, mask wearing is no longer required on public transportation. For instance, in Sweden, in the Czech Republic, you don't need to show your COVID vaccine when you head into a restaurant or a bar. So I think that's changing because, of course, they have higher vaccination rates in part. And Germany is not quite where they are in terms of full vaccinations. And that's one of the major reasons we've seen hesitancy here. And, of course, on the part of the health ministry as well, because, of course, even if it's Omicron, there are some cases of Omicron that could get more severe symptoms. So despite the fact that Omicron is not as bad as other forms of COVID, there's some concerns about the higher numbers we've seen.
Many thanks, Deutsche Welle correspondent Chiponda Chimbelu, joining us there from Berlin. And the Biden administration urged Prime Minister Justin Trudeau's government Thursday to use its federal powers to end the truck blockade by Canadians protesting the country's COVID-19 restrictions, as the bumper-to-bumper demonstration forced auto plants in both sides of the border to shut down or scale back production. In the meantime, similar protests like the one seen in Canada have also erupted in Australia, New Zealand and France. Here's more on the global update.
More people arrived outside New Zealand's parliament earlier today as protesters calling for an end to a vaccine mandate and tough COVID-19 restrictions refused to end their demonstrations despite arrests by the police. It's been 4 days since several thousand protesters, inspired by truckers' demonstrations in Canada, occupied the Parliament lawns in the capital, Wellington, and blocked surrounding streets with their trucks, cars, camper vans, and motorcycles. On Thursday, the police arrested 120 people as they attempted to forcefully remove the protesters. And in France, despite an order not to enter Paris, motorists protesting against COVID-19 restrictions are converging on the French capital from multiple cities across France, inspired by the horn-blaring demonstrations taking place in Canada. The motorists' protest follows waves of demonstrations over France's vaccine pass rules, which require people to show proof of inoculation against COVID to enter bars, restaurants, and other public spaces. Officials say France will deploy thousands of police in and around Paris today and over the weekend and set up checkpoints at toll stations on major roads leading into the capital to keep Freedom Convoy motorists out.
Visit our website, channelstv.com, for more updates and a better understanding of the pandemic. Plus, there are other stories breaking all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.